John wears so many hats in this community. He is a business owner. He is an extraordinary civic leader and volunteer. Today, we're particularly proud to highlight two hats that he wears. He is the co-chair of the Capital Campaign for Eskenazi Health, which has raised already to date over $75 million to support the new hospital, and he's also the chair of the Chamber of Commerce. And so we are so pleased to have his support and his voice today. And with that, my good friend, John Thompson.
Thank you, Matt, and thank all of you for being here. You know, this is just truly an amazing moment for me. I just look at, you know, all that this community has come together to do. And then when I look at the leadership here and what they've come together to accomplish here in Matt, Brian, and Lisa, I mean, I really applaud you and give you all a round of applause. As a business owner myself, and certainly a lifetime student of business and economic development, you know, there's no better way than bringing two organizations together to accomplish something. You know, it's always been my view that two heads are better than one, three's better than two, and you can do so much together. And I look at all that they've done already as separate institutions and what they've done in partnering together, like Dr. Kane just described. You know, I can give you other examples. In a past life, I chaired Indiana Black Expo, and they've come together with other healthcare providers and provided tremendous service in terms of 35,000 tests at the convention center. And I've benefited myself personally from those tests. And, you know, so I see Karen Lloyd here, who's also a past board member of Indiana Black Expo, and she's been in there day and night providing the test and running the people through, including me, not sticking, but certainly running them through. And I applaud all of that, really. As chairman of the Chamber of Commerce, I come to you and say that we all at the Chamber just applaud these two institutions coming together to provide better health care, better medical service, and do it in a very economic way. I like to add, you know, when I first heard about the opportunity to build a new Wishard-Eskenazi health facility, Matt Goodwine was describing to a small group of us, you know, what could be accomplished by all of that and what had been accomplished to date. And the improved service, the service that was already excellent, improving, but also the cost savings. And I think that that improved service with more effective cost management is what we'll see going forward. And you know, I got here 29 years ago, and I was amazed by this community and what it's accomplished working together, and the way that city leaders, children of our city, step up and make sacrifices for others and give to others. And you know, there's just no better example of that than Sydney and Lois Eskenazi in the $40 million gift that they provided to our capital campaign to make sure that we had the funds we needed to be successful. And alongside them came many, many others, including many of you in this room, the employees of Eskenazi Health, the doctors, and the broader community. And we've achieved over $75 million, but certainly not without your help. And I'd like to say again, Deborah Daniels has just joined the board of Eskenazi Health, but she's also my co-chair in the capital campaign. And the staff, they're all here, and they're the ones that make Deborah and I shine, because what they do is nothing short of miraculous. This is an example for the entire country of what can be done for a public hospital. And so to then see, with all that community's been doing across this community, come together with Eskenazi is just nothing short of extraordinary. And I'd like to thank both Matt Goodwine and Lisa Harris, and then also Brian Mills from Community Health Network for all that you all have done to make this moment possible. And I want to thank you all for being here today. Thank you.